Hello, my name is Lydia Young, and I'm a research analyst at Toronto Rehabilitation Institute, which is part of the University Health Network. As part of our Research Digest series, I will be presenting a few research studies from our Enhancing the Care of the Older Adult, or ENCORE, team. Today, we are summarizing nurse practitioners rising to the challenge during the CoronavirusDisease 2019 pandemic in long-term care homes, by McGilton et al. The key words for this article are COVID-19, dementia, models of care, nurse practitioners, and long-term care. Research questions. What are the roles and duties of nurse practitioners during the pandemic? How do these roles affect optimizing the care for residents? How do nurse practitioners support staff in long-term care during the pandemic? Why is this important? There is an urgent need to address the quality of care that residents receive in long-term care homes. This has been made more apparent by the COVID-19 pandemic. Nurse practitioners are a possible solution to this problem. Many nurse practitioners were present for in-person care during the pandemic. Through this, we can understand more about the nurse practitioner's roles and duties. Background. This study tries to understand the nurse practitioner's roles in optimizing resident care and supporting staff and management during the pandemic. Nurse practitioners are advanced practice nurses with graduate-level education and hands-on experience. They have been prepared to assess, diagnose, and treat residents living with chronic and acute conditions and mentor staff. Methods. An exploratory qualitative design was used. 14 nurse practitioners working in rural and urban long-term care homes took part in the study. The study conducted phone interviews with nurse practitioners. They asked about their experiences during the COVID-19 pandemic. Definitions. Exploratory qualitative design looks at a problem that is not clearly defined. It tries to better understand the existing problem and seeks to find possible solutions as described by those who are interviewed. Results. 4 categories related to the nurse practitioner's experience during the pandemic were identified. Containing the spread of COVID-19, attending to the multiple duties to reduce the spread, finding ways to manage the outbreak, stepping in where needed, filling in the missing pieces, working in multiple roles, supporting staff and families, being available, present, and relational, updating practices, providing emotional support to staff in distress, establishing links between fragmented systems of care, creating policies and strategies to build links, developing relationships with external partners. Conclusion. The study results show that nurse practitioners make a significant impact within long-term care homes. They focus on building and maintaining relationships with everyone. Nurse practitioners were able to build capacity and contributed to positive outcomes. This was due to their expanded scopes of practice and leadership abilities. Nurse practitioners took on many roles, especially during the COVID-19 pandemic. This showed the importance of having on-site clinicians to give expert assessments, care, and timely follow-up. They also worked well with staff to deliver care plans. We need more research for guidance on the best models for nurse practitioners in long-term care. Please visit our website at www.encoreteam.com, where you can learn more about the Research Digest and find a PDF version. If you have any questions or require more information, please email us at ellen.snowball@uhn.ca.